Hello mates, so we are here, with one more informative topic, regarding healthcare, and that is PCOS. In this video, we will discuss, what is PCOS? What are its symptoms? When to see a doctor? What are the causes of PCOS? What are the complications of PCOS? How it can be diagnosed? How it should be treated? And, how to prepare for an appointment. So, let's start it. What is PCOS? Polycystic Ovary Syndrome or PCOS is a hormonal disorder common among women of reproductive age. Women with PCOS may have infrequent or prolonged menstrual periods, or excess male hormone or androgen levels. The ovaries may develop numerous small collections of fluid or follicles and fail to regularly release eggs. The exact cause of PCOS is unknown. Early diagnosis and treatment, along with weight loss, may reduce the risk of long-term complications such as type 2 diabetes and heart disease. What are the symptoms of PCOS? Signs and symptoms of PCOS often develop around the time of the first menstrual period during puberty. Sometimes PCOS develops later, for example, in response to substantial weight gain. Signs and symptoms of PCOS vary. A diagnosis of PCOS is made when you experience at least two of these signs. Infrequent, irregular, or prolonged menstrual cycles are the most common sign of PCOS. For example, you might have fewer than 9 periods a year, more than 35 days between periods, and abnormally heavy periods. Elevated levels of male hormones may result in physical signs, such as excess facial and body hair or hirsutism, and occasionally severe acne and male pattern baldness. Your ovaries might be enlarged and contain follicles that surround the eggs. As a result, the ovaries might fail to function regularly. PCOS signs and symptoms are typically more severe if you're obese. When to see a doctor? See your doctor if you have concerns about your menstrual periods, you're experiencing infertility, or you have signs of excess androgen, such as worsening hirsutism, acne, and male pattern baldness. What are the causes of PCOS? The exact cause of PCOS isn't known. Factors that might play a role include excess insulin. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body's primary energy supply. If your cells become resistant to the action of insulin, then your blood sugar levels can rise and your body might produce more insulin. Excess insulin might increase androgen production, causing difficulty with ovulation. Low-grade inflammation. This term is used to describe white blood cells' production of substances to fight infection. Research has shown that women with PCOS have a type of low-grade inflammation that stimulates polycystic ovaries to produce androgens, which can lead to heart and blood vessel problems. Research suggests that certain genes might be linked to PCOS. The ovaries produce abnormally high levels of androgen, resulting in hirsutism and acne. What are the complications of PCOS? Complications of PCOS can include infertility, gestational diabetes, or pregnancy-induced high blood pressure. Miscarriage or premature birth. Non-alcoholic steatohepatitis, which is a severe liver inflammation caused by fat accumulation in the liver. Metabolic syndrome. It is a cluster of conditions, including high blood pressure, high blood sugar, and abnormal cholesterol, or triglyceride levels, that significantly increase your risk of cardiovascular disease. Type 2 diabetes, or prediabetes. Sleep apnea. Depression, anxiety, and eating disorders. Abnormal uterine bleeding, and cancer of the uterine lining or endometrial cancer. Obesity is associated with PCOS and can worsen complications of the disorder. How PCOS can be diagnosed. There's no test to definitively diagnose PCOS. Your doctor is likely to start with a discussion of your medical history, including your menstrual periods and weight changes. A physical exam will include checking for signs of excess hair growth, insulin resistance, and acne. Your doctor might then recommend a pelvic exam. The doctor visually and manually inspects your reproductive organs for masses, growths, or other abnormalities. Your blood may be analyzed to measure hormone levels. This testing can exclude possible causes of menstrual abnormalities or androgen excess that mimics PCOS. You might have additional blood testing to measure glucose tolerance and fasting cholesterol and triglyceride levels. In a transvaginal ultrasound, your doctor checks the appearance of your ovaries and the thickness of the lining of your uterus. A wand-like device called transducer is placed in your vagina. That's why it is called transvaginal ultrasound. The transducer emits sound waves that are translated into images on a computer screen. If you have a diagnosis of PCOS, your doctor might recommend additional tests for complications. These tests can include periodic checks of blood pressure, glucose tolerance, and cholesterol and triglyceride levels. Screening for depression and anxiety and screening for obstructive sleep apnea. How PCOS should be treated. PCOS treatment focuses on managing your individual concerns, such as infertility, hirsutism, acne, or obesity. Specific treatment might involve lifestyle changes or medication. Let's discuss the treatment of PCOS in detail. Your doctor may recommend weight loss through a low-calorie diet, combined with moderate exercise activities. Even a modest reduction in your weight, for example, losing 5% of your body weight, might improve your condition. Losing weight may also increase the effectiveness of medications your doctor recommends for PCOS and can help with infertility. To regulate your menstrual cycle, your doctor might recommend combination birth control pills. Pills that contain estrogen and progestin decrease androgen production and regulate estrogen. Regulating your hormones can lower your risk of endometrial cancer and correct abnormal bleeding, excess hair growth, and acne. Instead of pills, you might use a skin patch or vaginal ring that contains a combination of estrogen and progestin. Taking progestin for 10 to 14 days, every 1 to 2 months, can regulate your periods and protect against endometrial cancer. Progestin therapy doesn't improve androgen levels and won't prevent pregnancy. The progestin-only mini pill, or progestin-containing intrauterine device, is a better choice if you also wish to avoid pregnancy. To help you ovulate, your doctor might recommend Clomiphene. This is an oral antiestrogen medication taken during the first part of your menstrual cycle. Letrozole or Femara. This breast cancer treatment can work to stimulate the ovaries. Metformin. This oral medication for type 2 diabetes improves insulin resistance and lowers insulin levels. If you don't become pregnant using clomiphene, your doctor might recommend adding metformin. If you have prediabetes, metformin can also slow the progression to type 2 diabetes and help with weight loss. Gonadotropins. These hormone medications are given by injection. To reduce excessive hair growth, your doctor might recommend birth control pills. These pills decrease androgen production that can cause excessive hair growth. Spironolactone or aldactone. This medication blocks the effects of androgen on the skin. Spironolactone can cause birth defects, so effective contraception is required while taking this medication. It isn't recommended if you're pregnant or planning to become pregnant. Eflornithine or Vanica. This cream can slow facial hair growth in women. In electrolysis, a tiny needle is inserted into each hair follicle. The needle emits a pulse of electric current to damage and eventually destroy the follicle. You might need multiple treatments. To help decrease the effects of PCOS, try to maintain a healthy weight. Weight loss can reduce insulin and androgen levels and may restore ovulation. Ask your doctor about a weight control program and meet regularly with a dietitian for help in reaching weight loss goals. Limit carbohydrates. Low-fat, high-carbohydrate diets might increase insulin levels. Ask your doctor about a low-carbohydrate diet if you have PCOS. Choose complex carbohydrates, which raise your blood sugar levels more slowly. Be active. Exercise helps lower blood sugar levels. If you have PCOS, increasing your daily activity and participating in a regular exercise program may treat or even prevent insulin resistance and help you keep your weight under control and avoid developing diabetes. How to prepare for an appointment. You may be referred to a specialist in female reproductive medicine, that is, a gynecologist. A specialist in hormone disorders, that is, endocrinologist, or an infertility specialist, that is, a reproductive endocrinologist. Here's some information to help you get ready for your appointment. List symptoms you've been having, and for how long. List all medications, vitamins, and supplements you take, including the doses. List key personal and medical information, including other conditions, recent life changes, and stressors. Prepare questions to ask your doctor. Keep a record of your menstrual cycles. For PCOS, some basic questions to ask your doctor include: what tests do you recommend? How does PCOS affect my ability to become pregnant? What medications do you recommend to help improve my symptoms or ability to conceive? What lifestyle modifications do you recommend to help improve my symptoms or ability to conceive? What are the long-term health implications of PCOS? I have other medical conditions. How can I best manage them together? During your appointment, don't hesitate to ask other questions as they occur to you. Your doctor is likely to ask you a number of questions, including: what are your signs and symptoms? How often do they occur? How severe are your symptoms? When did each symptom begin? When was your last period? Have you gained weight since you first started having periods? How much weight did you gain, and when did you gain it? Does anything improve or worsen your symptoms? Are you trying to become pregnant, or do you wish to become pregnant? Has your mother or sister ever been diagnosed with PCOS? That was all about PCOS. If you have any queries, you can share it here in comments. Thank you so much for your time and concern. We really hope it has helped you in understanding of this topic. Keep supporting our channel by subscribing it. And don't forget to share with your friends as well. Have a good day.